So, as an epilepsy medical affairs outcomes researcher at UCB, mother and epilepsy patient advocate, I've seen firsthand the unique challenges faced by women of childbearing age with epilepsy. And some of those main challenges include complex medication management, including balancing seizure control, contraception, and pregnancy safety. Lots of barriers to information. Information is often inconsistent, conflicting, or inaccessible guidance from multiple healthcare professionals that a woman will see during the pregnancy journey. There's also stigma and fear of self-advocacy. And with that sense of lack of agency, women often turn to peer communities for support and information to develop that sense of agency and information. Probably something that it cannot be stressed enough is sleep deprivation and stress. We know that sleep deprivation and stress are just inherent to making that pregnancy journey and to parenthood. These are well-studied triggers for seizures, and support plans for sleep hygiene and stress reduction should be discussed early, ideally way before pregnancy. And I'd like to share some insights regarding the challenges from our recent study, experiences of women of childbearing age with epilepsy throughout their motherhood journey. It was a social media listening study that was recently published in Epilepsy and Behavior. And we looked at almost 250,000 social media posts from over 6 countries and analyzed those to understand better the motherhood journey for women with epilepsy. And there were 4 recurrent themes from these conversations. There was uncertainty and fear when changing treatment before and during and even after pregnancy, intensified worries due to inconsistent communication and lack of access to anti-seizure medication or ASM safety information. 3, anxieties balancing seizure control with a safe environment for the fetus and newborn. And 4, perceived barriers that these women were experiencing to safe pregnancy, safe delivery, and safe parenthood, especially breastfeeding, and including the lack of shared decision-making resources to better understand what their options were and the data that should inform their decision-making. And of note, many women reported information in our study, not that information was not being provided by clinicians or that it was difficult to learn and obtain, and that they received conflicting advice, which led to a lot of confusion and heightened anxiety throughout their journey. And also the authors note that there was really low discussion volume, interestingly, around longer-term child neurodevelopmental outcomes. And this suggests there's an opportunity and a need for education beyond major congenital malformations at birth. And this would include guidance on monitoring for developmental milestones. To drive industry to change, I see 4 main areas of opportunity. I think we need to improve multidisciplinary care by providing proactive collaboration between neurologists, OBGYNs, high-risk pregnancy specialists, and lots of early planning that comes before pregnancy, way before pregnancy. I think we need to empower patients as well as HCPs through education. This could be in plain language, stage-appropriate resources for, as I mentioned, for both patients, families, and providers. I think we need to enhance and promote peer support and advocacy and to help foster expert moderated forums and support groups and to improve provider education, to provide ongoing training on ASM management and reproductive health before, during, and after pregnancy. We really need to think about individualized treatment plans that would be involving regular medication adjustments during pregnancy to maintain seizure control and minimize fetal risk. Also, safety strategies. We need to begin discussion early on about household and childcare precautions with special attention to sleep hygiene and stress management, as mentioned earlier, to reduce seizure risk. And then also help women to make informed breastfeeding decisions. There is a lot of anxiety around that and understanding what choices that patients have. And most anti-seizure medications are considered safe during breastfeeding. We need to monitor infants for side effects, but that information and data needs to be shared with women to help inform decision making. Yes, thank you. I'd like to share more about a website that has been created, WACBA, Women of Childbearing Age. That is the acronym WACBA and it's an unbranded resource that was co-created by the UCB Global Expert Women of Childbearing Age with Epilepsy Council. And this council was included global patient experts and expert multidisciplinary clinicians, including epileptologists, neuropsychologists, and maternal fetal medicine specialists who care for women and their families. And these resources support those who wish to embark upon the pregnancy journey and those who wish to remain child-free, providing continuity for healthcare professionals and patients across all stages. And within this document, there are links to peer-reviewed expert resources about educational content, medication safety, decision support tools, including interactive tools and checklists, peer and provider support, including clinical best practice resources, more information about shared decision making, which are downloadable one-page guides and questions to structure provider conversations and empower patients. And also we provide links to the latest research and updates. And really just also add in closing that empowering women with epilepsy, as well as the clinicians who care for them through education support and coordinated care, is essential for improving maternal and child health outcomes. And the resources at the website walkbawwithepilepsy.com and ongoing research are really paving the way for a more informed and therefore confident motherhood journey.